This movie is on how professional doctors should use the rotating machine in their office. And I invented this rotating machine, first of all, with a handle so you can carry it conveniently from one room to another. It has a lock on here and lipstick to mark the foot. So generally at 12 o'clock to 6 o'clock you set it in front of the patient. And for this demonstration I'm using my casting table because it's easier for the camera to see. But this would be on the floor and you'd be on your knees casting the patient. And with this machine it allows you to teach other people in your office to get subtalar neutral. Because for years I've been getting doctors sending me in bad casts, so me and the doctor I was working with decided there's got to be a way of using the foam box. Because biofoam would tell you to push the foot into the box halfway, and that would leave you to have the heel pronate, supinate. It just tell you to try to get it level. And here's how some casts come in. As you can see, the heel is real deep and there's nothing up here. And this is what gets me. Educated doctors who went to school will send this in and think they took a good cast. And you don't have the patient walking around with their toes facing the ceiling. So I kept calling doctors and telling them to recast, which means they would send in two casts the same way. It means they never even looked at what they were doing. If they looked at the first foot, which is very important to see if it was correct, then they would do the second one correct. So I'd get a pair of feet in that would look like this. Or this, or a cast, these are demonstration casts, or a cast like this where the heel was all the way down and no toes in the box. Again, the patient must have been walking with the toes pointing up in the air. But if it was a normal patient, the foot would be level. And I have to see it in the lab to do the cast work. Or in demo number 2, I'd have the heel only halfway down. They would leave the arch not even in the foam and maybe push the toes down. Also pronating and supinating it. So how can I do my job correct? So you have to take a look at the cast. It's very important. And when you use this machine, you'll see how easy it is to get the cast properly. And here's a cast just to show you. You see how thick the heel is on the lateral side? This one came in just like that with the toes up in the air. And of course I can't make a proper orthotic like this, so I had to ask the doctor to recast. So with the patient sitting square in the chair, you take a box of foam, put it on a rotator, and if you ever saw, for the chiropractor, saw a foot doctor put plaster on, he's locking this foot at 90 degrees to the leg. He's going to turn the heel in, he's going to turn the heel out, and until he finds subtalar neutral by feeling for the inner space of the navicular talus joint. And when he finds that, he'll put the wet plaster on the foot, refine neutral again, and then he's going to take his thumb and push the foot 90 degrees to the leg. And right now, by placing the foot in the middle of the foam box, especially if you're mailing it to us, try to center it from left to right. You can move the machine around, and as you can see, this patient is pronating. And I am going to release the lock. And if I turn this counterclockwise, his arch is falling down. And if I just turn it clockwise, keeping a little pressure on the foam, you see you can supinate the foot. So right now the foot is supinated, it's pronated, it's supinating again. Of course it's sliding because I'm just trying to show you keep my hand out of the way. So what we would normally do is line up the knee and the ankle at 90 degrees, pull this forward or back until we have it 90 degrees, or ask the patient to come forward. I'm holding my index finger on a navicular and talus interspace. and I just slowly rotate the machine back and forth. Pronate, supinate, find subtalar neutral. When you're happy with subtalar neutral, you lock the brake and make sure you're at 90 degrees. And now I want to plug this light in so you can see underneath the foot. At this point, the arch is as high for this individual patient as it should be. The ankle is in subtalar neutral. If I put this red pen behind it, it gives you some idea that the heel is in the center of the Achilles tendon. I would like to put a camera behind it, but it's very difficult. But what I want to show is the first metatarsal is in the foam slightly right now, and the fifth is above the foam. And so would the second, third, and sometimes the fourth, depending on how much varus. If you had a foot with a 20-degree 4-foot varus, that's what, and if it was low. If you had a perfect foot, when you lock the heel in the back, all these heads would be touching the foam within reason. So at this point, and this is very important, I'm keeping my 2 fingers on the navicular talus joint. I'm going to place my hand on the knee, and I'm only going to push 25 to 30% on the knee. Remember, you will be up on your knees, so you'll have more pressure. You're going to press 70% on the instep. Also, these 2 fingers are going to steer that heel from going to the left in the foam or to the right. So and also help to push the arch down. So with both hands, I'm just going to push it down very lightly till I feel the bottom. Not trying to flatten the heel out, but I can just relatively feel the bottom. And the forefoot is staying the same. And with the palm of my hand, I'm going to place the palm of my hand not on the toes and not on the instep, but on the metatarsal heads. How's that shot?
Good.
Okay. The whole secret is right now is to get this heel is already at the bottom of the box, and you want to push this foot down, 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 down until the fifth hits the bottom of the box, and therefore you'll have the fifth metatarsal and the heel on a level plane, the same as it would if you were casting in plaster. So I am going to push all 5 heads, holding it the angle that it is right now, straight down, 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 until I feel the fifth. And if I want, and you don't roll your hand over and push the first metatarsal and second metatarsal down, because then you would be taking away the deformity that the lab wants to see. In 80% of the casts that we get in, there's a 4-foot varus of approximately 3-4 degrees. Now I'm pushing the toes down. And as in the instructions on the internet, of course though, you're supposed to center this in the box. I'm just letting it slide for the movie right now so you can see it better. Then you come back over the cuboid area, because when you have a long foot, you push the heel down and you push the fifth down, you can create too high of an arch here, which would look like it could be just 1/8 of an inch off. So you're going to come and just seat the cuboid. You don't want to push the cuboid to the floor. You just want to give it a little extra push to make sure on a large foot that it seeked its own level. And that's it. Now I lift this up. Now, if you had a foot with calluses, and there was a callus here, and it should be marked on the form, you take the lipstick and you could draw, let's say, a U right here, and you could show me this fifth has a callus here, and you can do this either before you cast the foot, which we'll do on the next one. You can lift the box up, put the patient's foot in, and just push a little bit. And as you can see, it left the lipstick marks in here. And you could actually push it down with your finger to show it to me, or leave a lipstick mark in here. Or if you're a DPM, And you put a fancy pad on here, a star shape, a metatarsal pad. Patient came back, you cut some fancy pad. You can leave the pad on or the moleskin, and it would make an impression on the foam, and we would see exactly the spot you're talking about and follow your instructions to take care of it. Now also keep a box of baby wipes so you can wipe off the lipstick. And this is what I stress at this point. This is where the new doctors get messed up. Take a pen. Take 2 pens out of your pocket. Hold it down on the lateral side. Approximately, touch it with your finger. Can you see that in the movie? Take it over here. Should be the same depth, approximately. If you're touching up here, that means you didn't push the whole forefoot down like I showed you previously in this movie. Again, I'm going to repeat it. Here's a right foot. Hold the pen all the way down, touch the top. You come over here and obviously you can see something's wrong. The fifth and the heel should go down the same level. And there's no excuse for it. You're a busy doctor. I don't care, you don't have a pen. Take your cell phone out of your pocket. Put it in the bottom here. Hold it. Hold it over here. Use that as a measuring device. Always check the first foot first. And if so, you could have put the foot back in here. The live foot. I'm going to use this piece of foam. And then continue pushing all the way down on that patient's foot until you corrected the situation and push it down further. Now, with the rotator, we're going to turn the box around, unrelease the brake, and you slide it way over here. And now we'll put lipstick over here. In case there was a wart, bony problem sticking out. Also, the tendon, it's running across from the sesamoid bone back to the heel. As I dorsiflex this big toe, you see the tendon right here. And I'm marking that. And if you want to show me that the tendon is, you want a groove for the tendon, you place the foot again at 90 degrees on the box of foam. Turn it clockwise, counterclockwise. You see it's pronating. Now I'm going counterclockwise. I'm putting it subtalar neutral. And again, can you see? Now you can see there's your standard 4 degrees of forefoot varus relative to the heel being in neutral. And again, you have a little youngster, 4 or 5 years old, and they're wiggling around their foot. Lock them in neutral. Lock your fingers right around their foot and push it down. They can't wiggle on you. And I'll sand the fingers off. Now we're going to take the palm of my hand over the heads again, and I'm just going to go straight down until I feel the fifth hit the bottom. Push the piggies down. Come back over to cuboid and seat it, and then lift the foot up. Just relax your foot over here. And now again you could see, I'll turn it this way, you could see the foot is vertical. And he has a normal pronating foot and a pretty straight leg if you watch them walk. So here it is vertical. Here's the fifth, approximately the same depth. You see it? And the first is higher. You could also push your pen in the heel to the bottom of the box. And if you push it right here in the center of the fifth, it'll make the same size hole. But here it's going to make a bigger hole because the first metatarsal is coming up to 3-4 degrees. And this is how you make a proper cast.